Hello, everyone. Welcome to Power Pantaloons podcast. My name is Tanya. I am your holistic cancer wellness specialist. Today we have Karen Owen with us. Welcome.
Hi,
How are you today?
I'm doing great. How are you?
I'm fantastic. So please tell the audience, what is your zone of genius?
My zone of genius. Well, first of all, I want to thank you, Tanya, for having me on your podcast. I really appreciate it. We had an instant connection a few weeks ago when we chatted the first time, and it just continues. What you're doing with your podcast, what you're doing with your community is priceless. And I just want to also recognize and thank you for doing that. That's amazing. My zone of genius. Well, let's see. I am a Martha Beck certified life coach. So I've been trained by a woman by the name of Martha Beck in coaching. And if nobody has heard of her before, I can just simply say she coaches Oprah. She's Oprah's coach, but she is amazing. And what she does in her coaching and what I have learned through her is the idea of magic in our everyday life that's there when we look for it. Look at your expression.
I love magic. We get
Uh-huh.
yeah, we could certainly talk about that, but go on. I don't want to interrupt.
That's fine. Thank you. So what I'm doing is I have spent many years doing healthcare marketing and hospital systems, and then and over the last 9 years, I have been a practicing coach in addition to a full-time job. Just recently left that full-time job for a full-time coaching business. So I've
Helping
established
people.
my own business, and what I'm focusing on right now is primarily coaching women who are feeling stuck so that they can get unstuck and really transform their dreams into reality. That's kind of what my zone of genius is about, is helping women get past that stuckness. And why do I think I would be good at that? Because I've been there. I know what it's like. And I think that there's such beauty on the other side of feeling lost.
There are so many places you can get stuck, and and sometimes when you're in it, it's really hard to see the beyond.
Yeah.
Like, specifically, I'm going to talk about cancer. Like when you're in the I'm focused on just this, you don't see anything. You can't even envision a life after your diagnosis. Uh, it it can be hard to imagine. And sitting here 16 years post diagnosis, I've gone months without remembering that I was a diagnosis. And I'll be like, oh yeah, like, and it's not, it doesn't bring that dread and yeah, that. So
So the
there are
stories
lots
you
of
told
different
yourself
stuffs.
when you were is probably the stories you were telling yourself as you were going through cancer were just so filled with fear and worry. I mean, how could you not, right? And when I say fear or worry, I mean you probably feared a, a whole list of stuff, right?
Actually true, because it was more like I really didn't think about it. I compartmentalized and I put it
Mhm.
over here, and I focused on the activity, because when you're doing things, you don't have to think
Right,
about the stuff. And
right.
so it was doctor appointment. What am I doing now? And prepping for doctor appointment, sleeping. I did a lot of sleeping because you become exhausted. Um, but I didn't let myself get negative. Um, and like, I don't know if you've heard of Gilda's clubs.
Oh, absolutely.
And so a lot of people haven't, for some reason. I don't understand why. But so I went a couple of times, and unfortunately, the couple meetings that I was there for, everybody just wanted to sit in misery and mourn their diagnosis. And I was like, okay, so all right, so what's everybody's game plan? What, like, what else are you doing? And crickets, nobody wanted to engage with me. And I was like, I cannot. Like this might be a beautiful place for some people, but this right now is too negative and toxic for me. I cannot allow any of this to be here.
Well, and
And
it's
so I
interesting
didn't,
because my understanding of Gilda's clubs was really to help people going through a cancer process to understand that there are things that they can do to get their minds and their bodies in a better, in a better place.
which
So
is why I went.
yeah, I thought so. Yeah.
And unfortunately, that's not the experience I had. I hope that that's what people are getting from it now, but I couldn't. I was like, I'm gonna go find something else because I have to be in a positive space.
Yeah, and it's interesting. It was Gilda's Club was an inspiration for some workshops that I did years ago with cancer patients, primarily breast cancer. But we would have therapists and yoga instructors and meditation. We had all of these offerings to help people with cancer get out of that state and in a little bit more of a calm can do, taking care of my body, self-care type thing. It was a Gilda's Club that was the inspiration. This was years ago. I'm hoping that there are still such structures set up for people that are, newly diagnosed and going through treatment. Because right now, the truth is, more people are living with cancer than dying from it.
Which is fantastic.
It's
But
fantastic.
but while we're
It's
talking
still,
about numbers,
yeah,
one in every two people will have some kind of a cancer before they die. So that's disgusting,
yeah.
but the reality. So cancer is going to impact everybody, whether you are the survivor or you're the supporter of the survivor.
Absolutely. Absolutely. Yeah. So I don't particularly, I mean, I'm not, my coaching practice isn't specific to people with cancer, but it is absolutely, like you just said, one in two. It's something that you address in any life situation, whether it's yours or a family member, loved one, friend, what have you. So yeah, it's so prevalent.
Absolutely. Interestingly enough, one of the most common questions I get from the supporters is, how do I support? And my first question back to them is, have you talked to your loved one? And I don't know how to. Okay, open your mouth and use your words. Like, ask them because they're the one going through the journey, and what's right for them is not right for someone else. So maybe they want you to make the casseroles to put in the freezer so that they are don't have to think about feeding themselves, or maybe they want you to help them clean their house because they physically can't do it, or maybe they just want you to sit with them and read to them, or whatever it is, or
Or
take
just sit
them to
with them.
appointments, uh,
Right.
whatever it is. And maybe it's knitting them the blanket that they take to the hospital when they go inpatient, or the hat because their head is going to be cold,
Or the scarf or whatever
or
headdress.
whatever it
Yeah.
is. Like, a lot of people have challenges with conversations that they're awkward in. So it makes the conversation awkward. And at the end of the day, this is somebody that you love and they're in a shitty spot and you want to support them. So just say that to them.
Yeah.
And that starts the conversation. This really sucks. I'm so sorry that you have this diagnosis. How can I support you? And it really can just be that easy.
And you had people that did that to you, communicated with you like that? How can I support you?
Nowhere during my diagnosis did I have any of my friends mourn me while I was standing in front of them, or give me expiration dates, or even talk about the possibility of me dying in front of me. Those conversations were had offline outside of
Yeah.
my sight, and that's fine.
And you
Uh, uh,
appreciated that, right?
Absolutely. Obviously, when I initiated the DNR conversation and the power of attorney and stuff like that, those are important conversations to have too. You have to have them. Um,
With or without a cancer diagnosis, you need to have them.
yes, absolutely. Absolutely. So yes. Um, yeah. I I didn't have to draw boundaries real hard because the support network that I had already put in place was pretty solid. But some people have challenges with their family or their friends or whatever, and some even have challenges with their providers, their doctors.
Oh, yeah.
And as far as I'm concerned, you have to have your friends, family, and your providers all in alignment with what your goal is, which is to kick cancer's ass.
That's right.
In case you didn't
Oh,
know.
no, I kind of knew that. Of course.
Well, like having a conversation with my oncologist about alternative wellness modalities, he rolled his eyes at me, and that's okay because it's okay because we had a discussion about herbs, and he told me no herbs because that might
Interact with
counteract
the chemo. Yeah.
with the chemo. He didn't care about the aromatherapy because he's like, whatever you're smelling, I don't care. Go hang out in the sunshine. That's fine. Crystals, sound, whatever. Like none of this matters to me because you're not ingesting it. That's like, and that was enough alignment for me because he wasn't going to actively try to get me to not do that.
Right.
So you have to pick and choose your battles. And he was such an excellent oncologist that
Well, and the other thing I would add to that, though, is, one of the things that I think a lot of cancer patients don't realize is they do have time to make decisions and to get second opinions and to make sure that they're a really good fit with their oncologist or their surgical oncologist, whoever they're going to be working with primarily, because there are those physicians out there. I know one oncologist in specific that is in the Philly market, that's an integrative medicine specialist that takes all of this into account with the chemo and the other treatments that come along with primarily breast cancer. But it's like you can do some shopping and make sure you find the physician that is best suited for you and your needs.
Yeah, I mean, getting an appointment with an oncologist without a cancer diagnosis is a nightmare. Like they,
Yeah.
they they just don't have time for you. They don't have time for any of your shenanigans. I- which I totally understand, but it like I had a mammo come back not
Oh,
perfect, and so I had to have an oncology consultation, and my gynecologist was like, "Listen, just go make the appointment, call my office back, tell me what the appointment is." And it was like 6 months later, and I was like, that's not gonna work for me. She's like, no, 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 I'll call the office now. And so we were able to move it up to like a month out. But like get it, yeah, their receptionist was like, we have no time for you. Like, you know, and I get it. I totally get it. But like it was scary. But what was really neat about this specific doctor is she was from India, and I love that because they're more open to the East meets West kind of philosophy when it comes to, and she's like, okay, so I know you're not gonna be interested in my prescription for Xanax. I'm like, you're correct. She's like, I know that you meditate and you chair yoga and stuff like that. She's like, what can we do to help you relax? I'm like, get my appointment to be tomorrow. And she's like, okay, we'll do our best on that. And then she goes to me, she goes, have you heard of the goddess Durga? And I thought that was a tremendously cool thing to have in a doctor visit because for me, it is mind, body, spirit. Like,
yeah.
and unfortunately, she moved to Florida with her husband because he got a good job or some such nonsense.
But she was there when you needed her, and that's what's
I,
awesome.
absolutely, absolutely. But you know, having the right to select your doctors, absolutely. Having the right to fire doctors. People don't realize they have the right to fire doctors.
Yeah,
Every
because
one of them, the second I walk in the door, you're going to lose some weight. I'm here for pneumonia. not
Yeah.
the size of my butt.
Yeah.
Can we focus on that, or are you fired? Like,
It's
and
amazing.
the surprised look on their face when you say that, they're like, how dare you? Like, how dare you? Like, I walk in the office and you automatically assume I'm diabetic and have high blood pressure. How about let's not make assumptions based on how I look and actually make assumptions based on what the medical records show? How about that?
Yeah. Or how about this one? Listen, just listen to me.
Yes, you cannot tell health based on visual. You can't. Like, that's a tree branch. Like, we could go down that and talk about that for hours.
But we won't. Okay, so let me ask you a question real quick, because you're in the life coaching business too, and I think your specialty, of course, is I is it well, I see behind you helping cancer survivors. So it's men and women. Anyone that's going through cancer right now are the people that you help,
Yes,
right?
yes.
Is there anything that I might be able to share with your listeners that would be beneficial given my life coaching experience and what I focus on?
You tell me. We talked earlier about what was it, clean versus dirty pain?
Yeah, we can talk about that real quick. Okay, so there's a psychologist by the name of Stephen Hayes, and he coined this phrase about clean pain and dirty pain. And his specialty is called commitment, well, acceptance and commitment therapy, which is different than cognitive behavioral therapy, but they're complementary in a way. Cognitive behavioral therapy is like, let's get your mind going and then act. Acceptance and commitment therapy is accept what it is, commit to act and act. So slightly different. So slightly different, but it's, and one of the things we do as life coaches is we delve into that thinking, what are you thinking? What's going on? Because oftentimes our thoughts are not helpful at all. So clean pain is what you feel when you learn you've had a cancer diagnosis. That hurts. Clean pain is recovering from surgery. The surgery, I mean, it just what it does to your body. That's clean pain. Dirty pain is what you think about it after that pain is gone, right? So many people will just kind of stay in that dirty pain, thinking, giving themselves the label of a cancer survivor, but not in the way that you do. It's not with a power dynamic, it's with a woe is me, right?
I definitely think that there's a difference between somebody who calls themselves a survivor and then people who use the word victim.
Ah, there you go. Yeah.
And, you know, you cannot control the situation. You can only control how you handle the situation. And after walking the year journey, because it took me about a year from diagnosis and the hysterectomy and the way they had to space out my surgery and uh, chemo and radiation treatments and all of that was about 10 months. So as far as I'm concerned,
Yeah.
it was a
It's a
year,
year.
right?
Yeah.
And after I was released back into the wilds because I was done with the treatment plan, um, I had the pleasure of really sitting with the fact that the thing that defined my feminine divinity tried to kill me
Mm,
and had to work through redefining what it means to be a woman post hysterectomy, um, elder crone, whatever you want to call that aspect. And I was 38, right? Like, it's a little young for that. And
yeah.
the complex nuances of the fact that, my body tried to kill me, specifically like my divine feminine tried to kill me. So, right, like there's a spiritual aspect to that. And it's just, yeah. So like when you talk about dirty pain, I think that is exactly what you're talking about, is that. And that honestly took me about 5 years to get through.
Really?
It took me a while to get through. It was not easy. It was pretty rough. Um, and definitely spent a lot of that time, not not dressing to look like a feminine pers
Hmm.
person.
Yeah.
You know, it it was rough. It was really rough. Um,
What do you think could have helped you at that time back then? What do you think? I mean, it could be also that you weren't willing to hear anything at that moment because you were overwhelmed with all of these other thoughts.
I think that's definitely part of it. Um, Having somebody look at me like I was a woman,
Mm,
and treating me as sacred feminine.
mhm.
Definitely, when you talk about things romantic dinners and holding doors open and stuff like that, and the right spark in the eye, like when you know that you're being appreciated for who you are, right? So there was some of that really started to open the door for me to do the healing.
That's nice. Well, you hit on something just a minute ago that is so critical to this idea of clean versus dirty pain, and that is asking yourself, what do I have within my control? What is it that I can do? Because I can't control anything else but certain things, what I think, how I behave, what skills I choose to learn, all of that is within me, right? So that can
Yes.
help you kind of diminish the power of that victimhood or of that dirty pain, because I think you landed on something too when you called it, you nailed it with the victimhood. That's what dirty pain is. Oh, I suffered this, or I suffered, that is a victim mentality.
Right. And so there are things that happen to your body when you're irradiated in the abdomen, and there's when they remove sex organs, there's going to be sex dysfunction.
Yeah,
And while they may have had all that information in that 300-page form you filled out, nobody talked to you about any of that. Nobody warns you about that. And I don't know if it's whether they're too busy focusing on trying to save you, or that they don't expect you to live, or they just don't have the time to talk about what happens after if you make it there. And you know I,
I,
navigating navigating through your new body and its functionality. And
I think it's really hard too culturally. Talking about sex in this country is not easy.
oh god, no,
I mean,
absolutely. But
and our doctors are not trained to do that. And I don't even know that the support staff is, right? They don't, I don't, I'm not sure, but it seems to me as though that's just something that just isn't, it's kind of taboo. It's like, why? It's such a big part of our lives.
it it is, and it's super important. And all of the people that I've had conversations with who have had hysterectomies have some form of sexual dysfunction.
Mhm.
And we're not talking about it as a society, which I think is a grave disservice to the 51% that are walking like, because at some point, you know,
Well, but there isn't a night that doesn't go by where there's not an erectile dysfunction commercial on television.
that's another tree branch we can go down. And
That's a
what
little imbalance, isn't it? Yeah.
the fact
We
that
won't. We won't.
the allopathic medicine, all they do is study white men. So everything that is all that we know is about how to save white men, and the rest of us are fooked because, and that's changing, but
That's
not
changing.
fast enough. Like
Yeah.
not fast enough. And
But the world has
I
more
don't know where that was
people.
going.
Well, it doesn't matter because the world, I think, is better because of people like you. You've gotten off that victimhood train. You've gotten on, you took your power back, and you know how to find the people that are going to be able to um treat you the way that you want to be treated. And I mean that both medically and, physically, emotionally, spiritual, you know how to get what you need. And you're teaching, I think, through this podcast and through your coaching others to be able to
Yep.
get what they need without feeling like they're stepping on toes or they're doing something wrong. There's nothing wrong with advocating for yourself.
I have a secret. It's okay for you to step on some toes sometime if they're too close and in your boundary. Yeah.
Mhm.
You have the right.
Mhm. Yeah, and I think that, I don't know, I don't believe that any caregiver is trying to take advantage or anything, but I don't think that they're all, like you said, it's changing, but I don't think that they're all really in tune with what your issues are unless they sit down with you and talk to you, right? And ask
Yes.
questions.
One of the things that I feel is the most important thing on the planet is communication and
Hmm.
having effective communicative skills and being able to articulate how you feel and then taking the minute or four or whatever it is to actually listen to what the other person is telling you. You'd be surprised at what you could learn that way.
Yes.
And I also think the older I get, the less people pleasing and other useless nonsense. You know what I mean? Like you just the tolerance for it is just there's no tolerance for it
There's none.
anymore.
It's at
Whereas
zero. Yeah.
right, and as a teenager or a young adult, that I put up with far more nonsense than I should have.
Well, probably also at 38, you
Well,
know?
yeah, at 38, I was still very young and naive, and having a cancer diagnosis really corrected that real quick.
You found your princess. You found your power pretty quick, huh?
My power pantaloons, I sure did. I, you know, that was part of the mindset, right?
Yes.
We were talking specifically about how you handle a situation. 16 years ago, I really didn't know anything about alter egos or superhero poses. But through my entire journey, I had one item on my to-do list, and every morning when I changed my underwear, I put on Wonder Woman's panties. That was what I visualized,
Mm,
and that was me. That was a physical representation of me actively deciding to live every day, right? Like
yeah.
that was a choice. Every day it was a choice, and I will admit there were a few days where that did not happen, but
More often than not, though.
yeah, like 98% of the time, I did actually manage to change my underwear. But when you're people don't understand just how quick the poison hits you. Like when you think about it abstractly and so I went in for my first round of chemo and I had to go inpatient 4 days because they had to give me rescue drugs before, during, and after. And if you are attached to the IV for a certain amount of time, you just have to be inpatient.
Yeah.
So it was 3 days of this 12-hour or 16-hour chemo
Fusion. Yeah.
a month. And then there were six treatments like that, but my oncologist called it chemo radiation sandwich. So I had so it was one a month. So 1, 2, 3 months. And then we waited a little while. And then I had 5.5 weeks of radiation. And we waited a little while longer. And then had another 3 months of inpatient stuff.
Mm,
And I did okay right up until about week 4 of radiation.
mm.
And So I show up day one for radiation and I am wearing, so you see this pink up here?
Uh-huh.
I am head to toe in pink this color. I little pink Barbie shoes with rhinestones, a Hello Kitty pocketbook, and a pink bouffant I Dream of Jeannie wig, right? And I toddle into the radiation oncology department, and the nurse goes, "Oh, honey, let me take you back up to the fifth floor." I said, "I'm here for radiation. I didn't escape psych." She was so embarrassed, and I thought it was hilarious, right? And every day I would go in and I'd have a different color wig on, and they would start betting on what color the wig was going to be.
So you entertained them. How nice.
I was trying to bring education to the fact, like I'd rather walk around with crazy hair than no hair, right? The bald, I have a very nice head, but like I wasn't digging the bald look for myself, right?
Yeah.
And alerting people to what's going on so that they could either ignore me if that's what they want to do or bring me kindness because obviously I'm going through a thing, right? And the everybody in the department realized just how I was feeling when I stopped wearing the wigs because I couldn't even put a wig on anymore. And during this time, I was physically driving myself to my appointments because nobody bothered to tell me that there are nonprofit groups out there that will that
And do
volunteers will
that.
take you to your appointment.
Yes.
Nobody fucking told me. I had no, it was 10 years later I found out that was a thing. And I was
Mhm.
mad because I shouldn't have been on the road. Like
No.
I it would not have been driving. That was not a good idea, but I didn't have any choice. And the social worker, frankly, was absolutely not useful. Do you have any questions? No, I don't have any questions. Maybe, I don't know. When I say that, say, okay, all right, well, here are some of the common things people talk about because you don't know what you don't know. And you can't ask questions about shit you don't know.
Right.
You just can't. So, so yeah, like absolutely useless on that end. And I don't think she meant to be absolutely useless, but you know, as we were talking about earlier, that this is the first time on this journey. What do I know? Right?
Yeah.
Like I if I have to do it again, I'll be way more prepared, right? Or if I have to when I'm helping people through it,
Yeah.
you know, these are some of the questions you're gonna have. This is your copy of my medical binder. It's going to be what you take everywhere you go, right? Like because I promise you, you're not going to remember what the doctor said, not even 10 minutes later.
Mhm.
Because you
No, not
won't.
at all. I mean,
You,
your head as a cancer patient is in so many different places too. I'm kind of surprised. Well, I wish, you talk about there are those people or organizations that support patients that will not only take them to their appointment, but also be the scribe, if need be. It's just that advocate, right? You just need an advocate because as a patient, you're ill, you're trying to get better and recover, but you need support, right?
yep. Yes. And I understand that there are HIPAA compliant apps. I haven't actually looked into it, but I believe that there are recording apps that are HIPAA compliant that you can just record your conversations with your doctors. And
Oh, that's okay. New technology. That's awesome. That's a little handy dandy advocate right there.
I mean, and you take your phone
Yeah, you do.
everywhere you go. So absolutely, right? So there's that.
Yeah.
Yeah,
So my question for you then, we were talking about, what my specialty is, and you said, yeah, everybody's had a time when they've been stuck before. I'm just curious, have you ever been in a position where you were stuck that may not be related to your cancer diagnosis?
I'm sure I have. Like, you know, with my weight, I was stuck for a very long time. And the stuckness had a lot to do with childhood trauma, being
Mm,
sexually assaulted,
yeah.
and basically gaining the weight as physical armor, because if I'm not attractive to look at, like that was, that was my 5-year-old self protecting me, right?
Oh,
Like if you look at my photo albums, that before 5 I was skinny little mini, and then after 5 I started chunking up,
mm,
and it's obvious, right? And working with my inner child, and I I'm unstuck now with it, because for the last 2 years I have been working on it, and working specifically on, you know, that piece of it, feeling safe enough in my skin that it's okay for me to shed the unhealthy weight. And I started eating way better. Started taking supplements. We do recreation because exercise is a punishment, but recreation is fun things.
there you go.
And a few months ago, I was walking through my kitchen, and my pants just hit the back of my leg. And I heard a click in my head, like an actual physical click. And my mind went, slender now. And I feel taller. I sit with my shoulders back.
Yeah.
I actually sit. Yeah. And now we're throwing out the frumpy wardrobe, and we're starting to get, well, I mean, when you walk through the living room and walk out of your underwear because you've lost so much weight, like
You
that's,
have to.
you
You have
have
no
to get
choice.
some new clothes. And so now the things that I'm buying are more confidence building, and stuff like that. And
That's
you
awesome.
know, just because I'm a life coach doesn't mean that I don't have to work on myself. I like,
I think we all do. I mean, that's one of the reasons why we go into coaching, right? But let me
yes.
ask you this: when you were saying your inner child, I was really intrigued by that because have you ever heard of Dick Schwartz and his psychology philosophy called internal family systems?
Nope.
Okay. So he's gaining a lot of traction now, especially with us coaches around this idea of internal family systems. And that is, we have inside us an internal family, and we do have that hurt inner child. We all do. We don't all suffer the same kind of trauma, but we all have that. And then we have these things, these other parts of us that protect that inner child. Some of them are firefighters, some are called managers. And then in a part of this internal family system is something called the self with a capital S. And that's the person that's who you've been getting to know all these years. It's that knowing, that wise soul right there in the middle, yourself,
Yeah.
and what you need and what you want. You're so much better at articulating it today. But it sounds to me as though you work through this idea with your inner child with the therapist. So you actually got, I mean, you're talking about it like you've gone through the process and you're on the other side.
I I don't know that I'm completely on the other side. And I definitely owe her another visit or three. You
Yeah.
go in and you see where she's at, and the inner temple, and you realize it's a little musty in there, and so you have to go clean it out a little bit, make it pretty, and bring her crayons or what, a cake or whatever it is she wants, and feed the soul, and
Yep.
have conversations with yourselves. Be still for a few minutes, put the phone down, all the electronics got to go away, and just sit with yourself, preferably outside
Yeah.
somewhere, maybe in the forest, while you take a forest bath, and sit with yourself and just be, and communicate with yourself. This is where your intuition, like you know what's good for you and what's not. You know.
You know,
You just ignore it. And the more you ignore it, the more you're able to drown that out. But it's there for you. Your body is talking to you all the time.
all the
Whether or
time.
not you're listening is
Yeah.
another thing altogether.
Yeah. Well, that's the other thing. We as human beings, we don't, oh, sorry. Stop. We don't like to deal with pain, right? Or suffering. So that we do all these things to, what's it called? Numb the pain, numb the feeling, that kind of thing.
Which in turn lengthens the time you have to deal with the
Yes.
oh yeah, right. The disease, right? So the disease is there, and the sooner you clear it, the easier it is to clear. But we're real good at ignoring shit until it really hurts us. And
Really good.
sometimes people just don't ever try to change. And
No. What's really interesting, comment here is whenever we're feeling some kind of strong emotion, whether it's anger or sadness or fear, whenever we're feeling that kind of emotion, I'm so sorry, stop. If we can recognize that we're feeling that way and sit with it in a stopwatch for 90 seconds, it goes away. But in that first 30 seconds or minute, we're like, gotta do something with this, right? If you just let it go, it passes. So that's a tip for your listeners. 90 seconds. You can endure anything for 90 seconds. Stop. Sorry.
all right, like that was actually the first time I heard him. I saw you shushing him, but that was the first time I heard him, and it's fine. I'm surprised the puppy parade hasn't gone through here.
Yeah. Yeah. So what else can we add today? I don't know how much more time we have. I'm so sorry.
Yeah, no, I think we're good. I think we're really good. And I like at this time I'd like to talk about your, what do you call it? A discovery call? What do you call it?
Yes, a spark. Yeah, a discovery call. What I'd love to offer your listeners as soon as my dog stops barking. Stop. Stop. What just a
We
minute.
can't hear her.
Oh,
We
good.
can't hear the
Oh,
dog.
good.
We really
Okay.
can't.
So what I'd like to offer your listeners is, a consultation, 20, 30 minutes, just to talk with them about where they are in their lives, what it is that they wish they had, what they, kind of delve into what dreams may be and talk about how it is that they might be able to maybe uncover them and then start to live them. So it's really about transformation, to turning your today reality into the one you really want.
Fantastic, Karen. I will make sure that that link is in the show notes for people. And
Yep, it's
I'm
just my email.
well, I'll make sure that that information is posted for them in the show notes. And I really want to thank you for being here today, Karen. It
Thank
was
you.
a fantastic conversation.
It was Tanya, and I'd love to come back. We'll have to find another topic to talk about.
I'm sure we will not have a problem with that, Karen.
All right.
Thank you, everybody.
Thank you.